Hello, my name is Kamara Bradley. I am a senior kinesiology major, and I enjoyed the topic that was selected for us. We did a program over global nutrition and food insecurity. I personally enjoyed the topic because it is something that I've studied before and that I have done previous research on in other classes. As someone who does want to go into the medical and health field, I do think that it is an important topic to cover, and I think that it is a big issue that is impacting our world today. So I think that it's very important work to look over it, and I think that it should be a topic that is widened in the research community.
Good afternoon, my name is Reagan LeBlanc, and I am a current senior health science major with the Department of Public and Allied Health at Prairie View A&M University. Throughout the course of working on this presentation, I like that I was able to collaborate with like-minded individuals to address an issue that is very relevant in today's society.
Hi, my name is Trinity Garrett. I'm a junior at Prairie View A&M majoring in health. And I found the topic selected for our group very interesting because it does have something to do with my field. And I feel like it was a very easy topic for us to talk about in great detail. Like, we could go on and on about a topic like that, so it was very easy.
Hi, my name is Amani Butler. I am a double major with health and nursing. The reason my group chose our proposal is because this is an ongoing world and social issue that is happening in our day-to-day lives.
My name is Andrew Gray. I'm a health major at Prairie View A&M University. I enjoyed this topic because knowing that we helped underachieving and struggling communities put food on their table just makes the world a little bit better.
Why food vouchers, and why is it necessary to combat global food insecurity and nutrition? Well, this is a problem that affects over 700 million people around the world. Current food aid models often focus on short-term relief rather than sustainable impact. It does not last very long. They limit recipient autonomy and choice, so it really limits independence on food choices. And it provides minimal support to local economies. There is a growing demand for innovative, community-driven solutions, approaches that address both immediate needs and systemic barriers to food access. A food voucher system, which we have proposed, dignifies access to nutritious food through local vendors, improves dietary quality and personal choice, and it also strengthens local food system and economic. What is my team's vision and mission? What do we expect to happen with this initiative? So our mission is to provide equitable access for everyone to nutritious foods through our food voucher system, which is a community-based solution that has more long-term positive effects than other prior established food initiatives. Our vision is for everyone, regardless of economical background or status, to be able to access nutritious food that is good for them so they can be healthier and live a better life, improve the quality of life. What is my team's goal and objectives with this project proposal? Our goals include improving access to nutritious foods, reducing global food insecurity, supporting local economies, and promoting long-term health and economic benefits. Some of our goals are to decrease the rate of food insecurity in underserved communities, encourage healthier eating by offering food vouchers that can be used on nutrient-rich foods, educating families and individuals on the importance of nutrition, and illustrating how food voucher systems can support local economies and small businesses.
For our program overview, our pilot regions are going to be determined based on food insecure areas or places that have limited access to nutritious foods. Our target populations are children under the age of 5, pregnant women, elderly individuals, and families with low income or that are displaced. We will be doing 2 types of vouchers. We will do a digital vouchers, which will be delivered via SMS or like a mobile app, some form of electronic communication or delivery. And then we will also do physical vouchers, so printed cards or QR codes or a personal ID for people that don't have that access to the digital form. The way that the food vouchers will work is eligible participants will purchase approved foods with the vouchers that are provided to them. And then those vouchers will be redeemable only at certified local vendors that are partnered with the program. And then the vendors will be reimbursed through a secure, centralized payment system just to ensure, some reliability for the money that they are not in turn losing, but the money that they are using to provide those people with that food, and then they will be reimbursed for that, so they're not losing profit. Next are the key components of our program, which will be nutrition education workshops, feeding initiatives for children, and then local vendor partnerships, as well as community engagement strategies. So for the nutrition education workshops, those are going to be interactive sessions with individuals of the community focused on healthy eating habits, meal prepping, and helping them decide what are nutrient-rich foods and choices that they should be making. For the feeding initiative for children, that's going to be a community-based or school-based program that provides daily meals to children that are maybe in low-income families or are at risk of malnutrition to help with their development. And then the local vendor partnerships, this is where we're going to work with local community vendors to do the vouchers through their businesses instead of using larger businesses, because this does help the economic growth of the actual community, which in turn will help the affordability and the prices of the food in the community that we're targeting. And then the community engagement strategy that we're going to be focusing on is just using surveys, interviews, and like focus groups to actually involve the community in the decisions that we're making and get their input and feedback on what actually helps them and what they're looking for. So next we have our logic model. The first step to the logic model is the inputs. So for our program, the inputs are going to be funding from public or private sources or partnerships with either local vendors, like we said previously, or other organizations that want to help fund our program. And this can be, local grocers, farmers, non-government organizations, and then also the input can be the technology or like the voucher distribution, so like what we're actually using to get the program in action. So just community outreach and then training staff as well to do that. Next on the logic model is going to be the activities. So the actual activity that we're doing in our program is distributing the food vouchers and then the use of the food vouchers. So this activity is going to be getting staff to distribute the food vouchers to people, whether that be digitally or physically within a community, and then the individuals that are eligible for the program to actually use that. And then after they use that, then it would be to to review and evaluate the actual use of the vouchers. And then after that, we have the outputs. So this is the number of vouchers that we've distributed, the number of participating vendors, the number of participating individuals in the community, as well as the number of households reached. So really just the statistics of everything that goes into the program and the statistics of the actual outcomes that we're getting. So then leading into that is the short-term outcomes, midterm outcomes, and long-term outcomes. So for short-term, we're gonna have increased access to nutritious foods, and then, improving purchase autonomy within people so they have, more ability to actually purchase food that they're wanting to purchase. And then the midterm outcomes are going to be reduced levels of food insecurity, improved nutritional status within that target population that we established earlier, and then strengthen local food systems. And then the long-term outcome is going to be overall reduced rates of malnutrition and then related diseases that have to do with that. And then an improved population health outcome and greater economic stability in underserved communities from the program.
But first, we're going to start off by going over our timeline that we made. And as you can see in the slide, each team member will take at least 2 to 3 weeks out of the month to work on their assigned task, whether that be team meetings, speaking with shareholders, conducting interviews. Will all take at least 2 to 3 weeks out of each month. So the whole entire project will take as long as probably a year. But with that being said, let's meet the actual team members. We have Kamara Bradley as our project leader. She oversees all the project ideas, makes team meetings, things like that. Next, we have Amani Butler as our health data analyst. You know, the job title's in the name. She collects all our data, things like that. And next, we have me as your community outreach coordinator. I engage with local stakeholders and conduct interviews. And next, we have Reagan as our grant writer. She does all the funding proposals, things like that, etc. And finally, we have Andrew as our nutrition specialist. And next, I'll be discussing our evaluation plan. As you can see on the slide, the evaluation plan consists of key indicators of success, things like conducting surveys and monitoring attendance at all educational events, and also tools for monitoring and feedback, like voucher tracking system.
Dissemination strategy. Final report. A comprehensive document distributed to funders, community planners, and stakeholders, summarizing key findings, project performances, success stories, challenges, and recommendations. Infographics for community education. Newsletters, social medias, and partner websites to reach broader audiences and encourage ongoing engagement. Stakeholders meeting. One-page policy briefs to summarize implications and recommendations for government officials and NOGs. Meetings hosted to discuss potential for scaling or industrializing program.
Off with the budget overview, it is going to be a total of $89,000. I made a table on my slide basically breaking down the category of each need and the amount to actually initiate this proposal to get it up and running. So for the program personnel is going to be $36,000. Monitor and evaluation is going to be $6,000. Administration is going to be $4,000. Nutrition education is going to be $12,000. Staff and volunteers to help with this proposal is going to be $10,000. Feeding programs is going to be $15,000. Transport and logistics is going to be $6,000. So overall totaling into $89,000.
Funding impact. Reach and impact. Over 300 children fed through the community-based funding initiative. Hundreds of food vouchers distributed to low-income families, pregnant women, and elderly individuals. Educationals workshop expected to reach 200 plus community members promoting long-term behavior change. Improved access to nutritious meals. Community empowerment. Local vendors and farmers will benefit from increased businesses through voucher redemptions. Stimulating the local economy. Program trains and employs local staff and volunteers, creating short-term job opportunities and community ownership. Health outcomes. Reduction in rate of malnutrition, particular among children under 5. Improvement in dietary diversity and overall health awareness in the target communities. Preventive health benefits that lower the future burden on healthcare systems. Return on investment. Every dollar spent directly contributes to life-saving interventions, education, and economic development. Small investments now will reduce long-term costs related to poor health, underdevelopment, and hunger-related crises.
For the call of action, this is important. This project is important because a lot of communities, low income families, and especially children, are experiencing food insecurity and malnutrition. Ways that you can help us by supporting us is feeding children, joining partnerships, educating communities on what to do, how to seek out for help, and also by building a model that can be scaled across communities in need.